Hi, I am Dr. Ria Mondol, consultant obstetrician and gynecologist. Let's discuss with a very common gynecological problem, that is polycystic ovarian syndrome or polycystic ovarian disease, PCOS or PCOD. Almost 90% of patients at our clinic present with varied symptoms of PCOS, and the age group is declining. Not only the reproductive age group, the adolescent girls are also affected by PCOS. So what are the criteria for definition? Number one, oligo or anovulation. Number two, hyperandrogenism. And number three, polycystic ovaries on USG. Any two of these three criteria, if they fulfill, we call it PCOS, polycystic ovarian syndrome. So oligo or anovulation present with menstrual irregularities, patients present with oligomenorrhea or hypomenorrhea. Oligomenorrhea is the interval of the menstrual cycle is prolonged, more than 35 days, and hypomenorrhea, that is scanty menstrual flow. And patients are very worried with this type of syndrome. Patients present with oligo or hypomenorrhea. And hyperandrogenism, that is manifested clinically or biochemically by hirsutism. We see excess facial hair growth and increased male hormone, that is testosterone level, in biochemical report. And third point is polycystic ovaries on USG. So the management is mainly focused on lifestyle modification, and as obese PCOS is common, obesity is a very common disease in modern society. So obesity is linked with PCOS. So weight reduction and lifestyle modification, this is the only helpful treatment in PCOS. Medicine has very little scope, and we have to focus on diet that is low or glycemic index, low glycemic index or intermediate glycemic index. We have to intake this type of foods. So what are the low glycemic index foods? Sweet potatoes, berries, apples, whole grains like oats, lean protein like eggs, that are low glycemic index foods that help the blood sugar level to elevate very slowly. And exercise and yoga are the main pillar of the management of PCOS, and yoga has also additive effect to soothe the mental worries. And as stress is related to hormonal imbalance, and PCOS is linked with hormonal imbalance, so yoga has a very beneficial effect on PCOS. And PCOS is linked to cardiovascular disease, diabetes type 2. So if we focus on lifestyle modification, we will combat PCOS. Thank you.